Hello, my name's Jodie Brunning. You're listening to PSDR, and today I'm talking with Professor Ashley Gearhardt. She's a professor of psychology at the University of Michigan, and she is one of the world's top 2% of scientists based on citation metrics. She's working in an area that has been traditionally understudied, but judging from the citation metrics, there's a lot of interest in your work, Ashley. So welcome and thank you for making the time today.
Oh, my pleasure to speak with you. Thank you so much for inviting me.
You were one of the people that and the lead author on pulling together the Yale Food Addiction Score, and that's been a really important, let's say, starting point or
Yeah,
foot in the sand to get to where you are today. Can you talk a little bit about that, please?
absolutely. So I started grad school at Yale University, I think it was 2005, 2006. And I actually originally went in to be an alcohol addiction researcher. I was doing work on alcohol and addiction. That was always my interest. And I just was seeing, in the context of the global increase in obesity and diet-related disease, when trying to understand that, more and more basic science, neuroscience was finding, wow, the reward mechanisms of the brain that we think of as really driving addiction, that's really driving for many people their experience of excessive overeating. Even when they want to cut down, they can't. And so at that time, when we were trying to say, wow, is there an addictive process at play in people's food intake? There was either a focus on kind of using just people's body weight and height as a proxy for whether they might be experiencing an addictive response, or asking people to kind of say, oh, I'm a carb craver, I'm a chocoholic, but it's hard to know what that means. So my group that included Kelly Brownell, who's a famous obesity and eating disorder researcher, and Will Corbin, who's an alcohol addiction researcher, said we need a better tool to identify the people that might really be showing signs of an addiction. So we went to the Diagnostic and Statistical Manual for Mental Disorders, the main criteria disorder tome in the United States. And we said, okay, if we're going to diagnose somebody with a substance addiction to alcohol or to tobacco or heroin or cocaine, we use the exact same criteria. We look at things like, are they losing control of their intake? Are they continuing to use even though they're having negative consequences? Do they try and cut down and they can't? Now we look at intense craving. And so we created a scale that applied those same diagnostic criteria, but just asked about the intake specifically of highly rewarding foods like chocolate and salty snacks and sugar sweetened beverages. And then we applied that and asked people to fill that out. And that's where the Yale Food Addiction Scale came from. And for the field, it kind of gave us a tool that's really closely linked with how we operationalize other addictive disorders and then applies that in this realm of our changing food environment.
Fantastic. And you point out that there might be multiple pathways
Yeah.
for addiction. So it's not a single pathway.
Yeah.
And this applies for tobacco as well.
Absolutely. So for all addictive disorders, they're way more complex than they seem. I do find when I talk to folks who aren't in the addiction world that they think it's kind of black and white. Oh, anybody who uses cocaine gets addicted. It's like, no, most people actually don't. Most people who use an opioid don't get addicted. Most people who use alcohol or smoke don't get addicted. There's a lot of different pathways that can lead one to that. When we look at it, a lot of what we look at the risk factors that can set people up. Some of it is early childhood trauma or life experiences can set people up to really rely on addictive substances or highly rewarding foods as a way to cope with the trauma, with the negative affect. We see some people are just have really high reward signaling and they're really highly sensitive to reward, and maybe they're a little bit more impulsive. And when you're then in an environment that's constantly pushing the alcohol, the gambling, the food in your face, you're more sensitive to it than someone else. And over time, that kind of can rewire the system where it's just, you're not so much about the pleasure, but about that kind of habit. So there's so many different things that are combining. And that's part of why we're kind of moving as a field towards really trying to understand, not just say, oh, just addiction, just obesity, but to try and understand more individualized mechanistic approaches of what is maybe driving it for this specific person. Is it more mood dysregulation, more sensitivity to cues? Do they need more help with emotion regulation strategies or dealing with cravings? So as the field, we're trying to not just treat the label as it's a one size fits all.
Absolutely.
But I think, just to think, but what we do see is that when people live in environments that are really pushing an addictive substance and they're advertising it and they're targeting you since you were a teenager and it's cheap and it's accessible and it's everywhere, that increases the public health cost and the societal vulnerability to experience an addiction. That's what we saw with tobacco. That's what we saw with opioids. And I would argue that's what we're seeing currently with ultra-processed food.
Absolutely. And we'll get on to ultra processed food. But what I just wanted to emphasize with the Yale Food Addiction Score, YFAS, is that you've set this up as a clinical research tool. And I'm quoting you here, rigorous psychometric validation in a number of samples has been found to have strong internal consistency, test reliability, and convergent discriminant incremental validity. So we want to emphasize how good and robust the YFAS score is.
Yeah, the YFAS has been now used and it's been cited over 1,000 times. There's over, I think we were working on a report, there's over 400 unique empirical studies using the YFAS. It's been validated across at least a dozen different countries and languages that I'm aware of. And so, and that's like, I feel like I'm not like, I can't like, I didn't come up with these criteria out of thin air. I just took the criteria that had already been validated and been used for decades across tobacco and cocaine and alcohol and just said, well, if we really think there might be an addictive process at play, let's use those well-known and established criteria and see if they apply here. And the research to this point in adults and kids and countries around the world say, yes, that does seem to be telling us something clinically meaningful in a valid and rigorous way.
Fantastic. Absolutely. And at about the same time, as you were mentioning, in 2009, Brazilian researcher Carlos Monteiro and colleagues were designing the NOVA score. Excuse me. So that gave, I would say, the world a language for ultra-processed foods.
Totally. I totally agree with this because when we did this study, we called it the Yale Food Addiction Scale because there wasn't a lot of evidence yet on how to label the kind of category of foods that people were likely to struggle with. We knew when we reviewed the literature, we prime people to specifically think of certain food types when they're filling out the YFAS. And they're common ultra-processed foods. They're sugary sweetened beverages, they're sweets, they're fatty, salty snacks. It's the common UPFs. We see that, and this has been borne out when you look at the research, when we don't prime people with any sort of foods and we ask them to rate different foods and say, how much do you experience these problems with kale versus salmon versus ice cream versus chocolate versus pizza? It's common sense. It's the chocolates, the pizza, it's the chips. That's what people are losing control over. And the minimally processed foods that are good for your body, that nourish us, that have been the majority of the human food supply for most of our existence, people can kind of clue into their hunger and satiety signals when they're eating salmon and broccoli and whole grains. When you start trying to listen to those subtle signals in your body when you're subsisting on chocolate and French fries, the reward signal seems to overwhelm that. And the ultra processed foods, they just are hyper palatable. They're everywhere. Usually in the past, if you wanted to make a cookie, you had to make a cookie and it took time and energy. Now, I go to the gas station and when I'm checking out, I'm just completely surrounded by a cave of crap, of highly rewarding processed substances that are engineered to hook me, whether it's the tobacco or the alcohol or the whole cascade of candy bars.
Absolutely. And your your research into this went for a deep dive in 2015 when you did that paper with Schultz and Avena, which foods may be addictive. That was a 120-person study. Ultra-processed foods share pharmacokinetic properties, concentrated dose, rapid rate of absorption that is similar to drugs of abuse, and it's also gendered. Could you talk to me about that 120-person study, please?
Sure. So we did 2 samples in there. Here are the exact, I think we did one that was 121, that was like 300 in that. But now we've done this, replicated this in a bunch of different studies, so of other people. And so what, when you look at addictive drugs, almost all of them are man-made. That we don't have a joint tree where you could just go get you don't have like a river of pina coladas. They are humans taking something that is a leaf or a fruit or a starch, and we process it and we alter it and we refine it in a way where there's some sort of reinforcing substance that hits the body at a high dose and rapidly. That rapid rate of absorption is really key to addictive substances. And so what you see is that when we look at our food supply, things like an apple has sugar in it, but the way it's delivered in the apple is at a lower dose, and it's got fiber and it's got water, and it takes a while to eat and a while to digest and a while for our body to break it down. In contrast, when you get that same amount of sugar in a Coca-Cola, right? There's nothing to slow it down. It's been processed, it's been refined, it's been amplified with all these flavor enhancers and caffeine, and it hits your body rapidly like this. That's the same exact thing that we've done to create addictive drugs. And really the reward and motivation system that addictive drugs use to drive forward the compulsive pattern of intake is the exact same reward system that was really shaped to make sure we were getting enough calories, that you remembered the bushel of berries, and you remember that there was like a bison you could hunt over that hill, that you were more likely to survive and pass on your genes if that was how your brain worked. Well, we've just refined and processed in the same way our food supply, so it's giving these rapid, high delivered doses of fats and sugars or chemicals that mimic those, like artificial sweeteners, in ways that our body just doesn't quite know how to handle. And we're seeing those same behavioral indicators of addiction, of the loss of control and the intense cravings, the inability to cut down, even if you know you have a life-threatening illness, is what we're seeing. And I just don't think that's a coincidence, especially because we look at who bought up processed food and beverage companies beginning in the late 1970s and 80s, and it was big tobacco. It was R.J. Reynolds, it was Philip Morris. They bought up processed food and beverage companies, and there's documented evidence in top journals that they really took the know-how that they had on how to profit from tobacco cigarettes, and they applied that to alter their food holdings.
Absolutely. And in 2023, in the BMJ, you wrote the core mechanisms of addiction, such as reward-related neural dysfunction, the impulsivity, and the emotional dysregulation, as well as poorer physical and mental health and quality of lower quality of life. So you think about tobacco, you think about alcohol, and you can think about ultra-processed food.
Yeah, I gave a talk recently to like an addiction science audience. Then we all had lunch together afterwards. And like of course, and this is part and parcel, the American food supply is over 60% ultra processed foods. And lunch they had, of course, and I eat these foods. I'm not like this, like I'm not saying, oh, nobody can ever have a potato chip ever again. In the same way, I'll have a glass of wine, but I think they have a risk associated with them, addiction and health risk. And I don't want that to be the majority of our food supply. But we walked in, people kind of picked up the potato chips or the Oreo cookies, and they kind of made fun of like, oh, kind of laughed it off. And I was like, well, 20 years ago, we would have all been sitting in here smoking cigarettes, because that's what was really normal. 40% of Americans were smoking cigarettes. We would all be breathing in because somebody in here would be smoking. We'd be breathing it in. And it doesn't look like heroin or somebody like being so drunk that they can't drive. But the most deadly addictive drug is tobacco. Kills more people than cocaine and alcohol combined. when we look right now at diet-related disease and the public health consequences of that, it mimics tobacco, it exceeds alcohol. And so while, somebody can eat a milkshake and still drive their car and aren't, so intoxicated, just the way you can smoke a cigarette and get behind the wheel, the toll on mental and physical health is really staggering.
What you've just said then is really important. It's a toll on mental health as
Yes.
well as physical health. So
I think that is some of the most important research that's coming out. There's this huge article that just came out in 2024. Lane is the first author, also in the BMJ. And it's this huge umbrella review of over almost 10 million participants, going across all these trials of ultra-processed foods and kind of really estimating the effect sizes of the impact. And some of the strongest negative impacts were on depression and on anxiety. And there's these perspective trials where they look at people who don't have depression, who don't have anxiety, but who are eating a high ultra processed food diet, and they follow them 5 years later, 10 years later, and those eating those high ultra processed food diets, even when you control for things like socioeconomic status, they're at much heightened risk for developing a new depressive episode, a new anxiety disorder. Same thing's true with addictive substances. It's this vicious cycle often that people are stressed or they're feeling depressed or they're feeling anxious and they use alcohol, cigarettes, ultra-processed foods to feel better momentarily. But in the long run, it actually impacts your gut, your brain, your inflammatory systems in a way that makes you more depressed, more anxious, more stressed, more vulnerable to those products. And so it is this vicious cycle. Now, generally, we protect children from addictive substances because their brains are more vulnerable. They're less emotionally savvy. But in the US, the majority of their caloric intake, especially for teenagers who are at super high risk in the US for mental health disorders, anxiety, depression, 70% of adolescents' caloric intake is ultra-processed foods. I just have such a hard time believing, again, that it's a coincidence that it isn't a contributing factor, that at the time period in which ultra-processed foods began to dominate our children's and our teenagers' dietary intake, mood and anxiety disorders started to skyrocket. It's not the only factor, clearly, but given the mechanistic work, given the epidemiological science, I think we really need to run down in a rigorous way the contribution of our poor nutritional health to the poor mental health of our children and our teenagers.
they're seeing the repetition of 50 to 60% of the calorific intake. It's the same in the UK, it's the same in Canada, it's the same in Australia, it's the same in New Zealand. All the Anglo nations have succumbed to this, primarily through, to me, a lag in scientific research, in providing the resources for science to demonstrate what is occurring here. And
absolutely.
Before this interview, I did a hunt for food addiction on all the top universities in New Zealand, because I'm based in New Zealand, and there's not a single research on food addiction. And this is quite staggering because New Zealand has one of the highest rates of obesity in the OECD.
Yeah. Interesting, yeah.
Our Maori and Pacifica populations are particularly they're particularly suffering, and we're seeing the failure of the top echelons of the Ministry of Health to even consider metabolic syndrome, to consider an Official Information Act request I made, and they're not considering metabolic syndrome, they're not considering ultra-processed food, they're not considering multimorbidity, and they're not considering the multi-scalar nature of converging illnesses. So we've got a real problem here in New Zealand, and that's why it's really important talking to you, because we don't have anyone who has expertise in food and ultra-processed food addiction in particular. Sugar is being looked at by Simone Rodder, but that's all. So it's really important.
Yeah, no, I'm so happy to talk about it. And you bring up a good point. Like, we find similar work and that in our research, that particularly some of our communities that are the least well-resourced, that are more likely to experience trauma through racism, through intergenerational traumas, that that can increase your vulnerability to these negative outcomes. And I've been really struck by emerging research on the academic consequences of eating low nutrient, ultra processed food diets. That when I think of in America, our children who are maybe most vulnerable due to high stress, high poverty, high discrimination, are also being asked to operate in food environments that are even more toxic than the average American, that they're in food deserts where there's no healthy food and they're being swamped by ultra processed foods, marketing for ultra processed foods that cycle with when money becomes available through government assistance. The food environment gets worse for those folks. Advertisements get worse. The ultra processed foods get more advertised at the end of the aisle. And so if that is impacting them on a mental health capacity, impacting their ability to concentrate on school, impacting their ability to retain information, in addition to their physical health and well-being, that's just a travesty because we all have to eat. We don't have to make a decision about what sort of, substance we're going to ingest through a tube today to survive. We don't have to like smoke the cigarette and say, oh, am I going to have the denicotized cigarette or the nicotine one? However, we do need to go into the grocery stores, go into the restaurants, and if they're overwhelmingly promoting hyper rewarding foods that our brains are already more sensitized to, and they're more convenient and cheap, it's really it's a systemic level issue. We can absolutely give people tools to try and help them navigate it, but we see from addiction epidemics over and over and over again, it's not something that we treat our way out of, or we ask people to somehow have the willpower to resist the research and development of multi-billion-dollar international corporations. We change the environment.
Yeah.
We change the economic structures, we change the availability, we change marketing strategies, and that's how we see public health victories. And we can do that. All of those two things are tools that are available if we have the will and the science to be able to act.
Absolutely. And in New Zealand, in South Auckland, that's been labelled, a researcher found that was a food desert. So New Zealand does have the problem of food deserts as well. And speaking of vulnerability, in 2024, you did a paper with Scheistel and Wolfson. Is that the correct pronunciation?
Yes, correct. Yep.
The qualitative evaluation of food addiction across the lifespan. Now, that only looked at 16 people. It was low powered, as they say, but it involved in-depth, semi-structured qualitative interviews, looking at 3 developmental stages: childhood, adolescence, early adult, and middle adulthood. Can you tell me about the findings?
So, and that work, was a really deep qualitative dive where we just went really deep with people. I have to think, we have studies with like 100,000 people in them, but we can't go as deep. We can't talk to them for hours about their life. And that's kind of, we prioritize that here. And some of what we found really fits with what we see in the broader quantitative work that, we talk to people and often they would say, like, I was showing signs of addiction really early in my childhood. I was super sensitive to the reward value of these ultra processed foods. I would steal candy bars from the supermarket. I would eat till I would throw up even when I was little. But it really got bad for me in adolescence and early adulthood when kind of there was less buffering of adults in my life. I started to kind of take on the autonomy of my own food decisions, and my parents or others didn't have as much say. And that's when I just really lost control, and it started to impact my mental health, my physical health. And then I tried to cut down because I was like, oh my gosh, I gained 50 pounds. I have pre-diabetes and I'm 22 and I couldn't. And that reminds me of smokers, that people kind of smoke, I quit whenever I want. And then all of a sudden they go to the doctor and they're having heart disease and they think, okay, now it's time to quit, and they're addicted and they're hooked. But we also really saw that, and we see this a lot with cigarettes where you're not intoxicated, is that middle adulthood, when you've got kids and mortgages and you're working and you have even less time, you're even more reliant on the convenience and a food environment that's promoting ultra processed foods. Is they're like, this time in my life of middle adulthood is so hard because I'm so stressed. I have so many demands on my time. And I think one of the things that's really struck us about that research was that we weren't recruiting on this. We've done follow-up work now, and individuals who have food insecurity, is that a lot of the people said, when I was a child, my family didn't have enough food to eat. And so there were times where we would have money, right when we would get assistance or money would come in, and then we'd buy a lot of food, but by the end of the month, our food was gone. And so it really sensitized me that when food is available, you eat it. So now we've been following that up by looking at food insecurity in the United States and people not having access to food in general, let alone nutritious food all the time. And that seems to kind of sensitize reward mechanisms, stress mechanisms, makes you really sensitive to all these food cues in a way that would have been really evolutionarily beneficial. And the traditional food environment where there's not you're not flooded by calories, but food is scarce, that would have helped you survive. But now in this food environment is really a detriment.
Absolutely. And just through the stages, dentists find that in adolescence, that's when the cavities spike. So we're seeing, and in New Zealand, we see near the high schools, we see what we call dairies or milk bars, and the cafeterias, are selling ultra processed food, and basic sandwiches that have not much in them, and we don't feed our kids. And there's a bit of a debate at the moment, and Professor Julia Ruckledge has stepped in and said, well, we can feed them school lunches, but they actually have to be nourishing. They can't just be more sandwiches, more pizza. And
so it's not just about, I like that people have moved from the term, are starting to move a little bit towards the term from food security to nutrition security. Because I think we focused on just, okay, well then do people have calories? But then there's a lot of people who have obesity and metabolic syndrome, but are actually not nourished. They don't have sufficient, macro or micronutrients. And so it's like that hidden hunger, where you might look at someone and say, oh, you're not food insecure. Like your body weight would suggest that you're eating sufficient calories, but you're nutrition insecure. You're not getting nourishing food. And honestly, for many of us in the modern society, because the ultra processed foods are so dominant, many people are nutrient insecure because they don't have access to affordable, convenient, real nourishing food.
And we have intergenerational, I guess, cultural shepherding to be generous and bring, 12 loaves of bread to the party, but if you brought a salad, you'd be accused of bringing chicken feed or something like that. And so it's also the concept that in home economics in education, I was speaking to a teacher in the Bay of Plenty, and he said that basically they're funded with bread and sugar and wheat and sugar, and he saves his money hopefully so that these senior students can understand about hacking nutrition, but they simply don't have enough money to day after day teach children how to cook meat and vegetables and good pulses and healthy food. So they're baking courses, which
you're right. It's really a systems level that has prioritized profits over health. The profits of the big companies. And because at the end of the day, real food takes time to create, and real food rots. It can't stay in a vending machine for 4 months really and taste as good as the, bag of potato chips or that like cookie. And so just the profit margins are just so, and the government, the power. Then there was an article that came out that said the ultra processed food industry markets more than the alcohol, lobbies more to governments than the alcohol industry, gambling industry, and tobacco industry. So they have a ton of money and they have a ton of power. And that doesn't come without cost. Like the average person is suffering in a mental, a physical health way to prop up the profits of these big companies. So they benefit, but we're the ones paying the price. And our governments, our policymakers, the people who kind of really hold the levers of power, many of them are in the pocket of these. It's just like tobacco all over again. It's the same playbook. The incentive structure really supports the status quo. So we're really going to need to push our elected officials or health officials to advocate to change the food environment that makes it not a luxury to be able to afford real food.
Yeah. And New Zealand perhaps 20 years ago had a preventative health policy, but we don't anymore. So we don't have any academics, the academic environment, there's so few. And then the Ministry of Health, the top parameters are all about, vaccine intake. They're about getting people through hospitals quickly. So there's no markers in there for prevention and for say, stopping, you find pre-diabetes, let's stop diabetes.
Yeah.
Or there's none of that. And can I just circle back to what you were talking about in terms of being hungry? And can you talk a bit about satiety, please?
Yeah. Yeah, absolutely. So, our hunger and our satiety signals are very, very intertwined with our reward and motivation systems. And again, this makes perfect evolutionary sense. If you were starving, your ghrelin, your gut hormones that say, hey, I am calorically deprived, I am not nourished, would heighten. And the sort of hormones like leptin that's saying, oh, I'm full, I'm good, we're not going. You have this kind of go signal, and that go signal in the gut that you weren't getting enough, that you didn't have enough calories, directly goes up to the reward and motivation systems of the brain, the mesolimbic dopamine system. And so what we see is that when people are hungry, their reward and motivation systems are more reactive to cues, and they're more motivated. And that's true whether it's ultra processed foods or actually addictive drugs, cocaine, cigarettes. When we're hungry, we're more vulnerable to addictive drugs as well. Like 12-step programs always say, don't get super hungry, because it's one of the big triggers that people have identified. So, and that was helpful for us, for a long time. But now, in this current food environment, it seems that ultra processed foods, even when you're getting a lot of calories, just the way they're engineered, the food matrix, the bite rate of them, they don't trigger satiety in the same way that real food does. They just, this probably speed in which they're consumed and the removal of things like fiber and water and protein. You can take a lot of calories, but you don't feel satiated in the same way. And so it almost leaves the body that even if you're getting all these calories, it still thinks it's not being nourished. It still thinks it's in that high stress period that it needs to go seek out more food and more calories. And that's why there's some interesting work that's coming out on these GLP-1 agonists, which are the weight loss medications that are coming out that seem to really make people feel more satiated and slow down digestion and kind of turn down that, I'm starving signal in the brain. Is that they don't seem to just be reducing drive for food. They also seem to be, there's some early evidence that they're reducing drive for addictive drugs like cannabis and alcohol and opioids. And so, at the end of the day, this idea of feeling nourished and satiated that isn't just about how many calories just got mainlined into your body, but what is kind of the quality of the food and the whole package of the food that you consumed plays a big role in how satiated and nourished you feel.
That's absolutely it. And I was speaking to Dr. Jen Unwin previously. The clinic that she works in the UK with her husband, where they're reversing diabetes and pre-diabetes. I asked, what about the cost? Because of course it's seen that if you move away from an ultra-processed diet to a more nourishing diet, it's more expensive. And she said they aren't based in a wealthy area. And what they're finding is that because people aren't mainlining and then in 30 minutes to an hour thinking about the next treat,
Absolutely.
they're finding that the cost of positioning away from ultra-processed food is roughly similar to adopting a more nourishing diet. So
that's really interesting to think about. I think that makes a lot of intuitive sense. That it's when I talk to people and I'm like, it's just stuck with me so much, and the food industry uses it. It's like the more I eat, the more I want. And the food industry says, they'll say we design our foods to induce moorishness, this like feeling it. And that idea of, I think of that with alcohol. It's like it's a hot day and you come in and you have you want a glass of water so bad, and you have a glass of water and it makes you feel hydrated and you don't want more water. If it's a hot day and you have a beer, well, then you want another beer. It's actually priming you to want more. And I think the biggest thing that I would really like the scientific and public health field to start to grapple with, in part, there's many things, but one of them that I think we're focusing a lot on economics and costs. That's really essential. But the thing I keep seeing in so many studies that I think is a little harder to tackle is convenience. And so, when it's like, look at what are people choosing? It's what they like, but also what's convenient. And again, because real food takes some prep time, usually, it's not as easy as just opening the bag or tossing it in the microwave for 30 seconds. You need to kind of wash the veggies and and that's great, but we're all very time poor. And so we kind of need to think about what are structures that we can do to make healthy, nourishing foods, not only affordable, but convenient and accessible. And so we're partnering with this company right now, Fresh and Lean in the United States. That's a food. It does like Mediterranean, minimally processed style meals, and it flash freezes them and retains their nutritional value. And it has a food, like I tried it out myself. It has something like, cauliflower rice. So, made out of cauliflower and shrimp and cherry tomatoes. And it's so tasty and it's convenient. It's ready in, 90 seconds. Versus if I have two little kids and I work a crazy job, if I had to like make the cauliflower rice myself and peel the shrimp and dice the garlic, dice up the garlic, to be honest, a lot of days I don't have time for that. And so I want to think about, can governments, can insurers, can start to think about, can we subsidize? And rather right now, all the economics are making the fast food, making the ultra processed foods unnaturally cheap. That's in large part because of policy. If we can, and we're not including the healthcare costs that are associated with those products, they're not being filtered into the economic model. If we could actually take some of that money and know-how into making tasty, nourishing food affordable and accessible and convenient, I think that would go a huge way to improving people's mental and physical health. And in a way that's achievable. I think we're not going to like teach everybody to kind of scratch cook in a quick way. We should do that. We should teach people to cook, but we also need to kind of meet people where they are in the modern world.
I think there's you've got to dovetail all these things.
Yes. Multifaceted.
Yeah, Jamie Oliver, he was called a moral entrepreneur for trying to change all these people. But of course, so you need the culture, you need the take up. And so what the unwins have seen is that people that started the diabetes reversal course through the low carb diet back in 2013 are now there on the WhatsApp messaging, coaching the new people. Because food is so sublimely communitarian. It's something that we do. And so then they can help people hack, for example, cooking larger meals, freezing meals, doing a cook up on a Sunday, and learning to hack nutrition, cooking something really basic like mince that can be then cooked 5 different ways. And so this is kind of glorious. We can do this, and social media is a really good mechanism for that. But now I'd like to move on quickly. So the prevalence is interesting. So so food addiction is estimated to occur in 14% of adults and 12% of children. So that's come out with Praxides et al. In 2022.
Based on over hundreds of studies conducted around the globe. And when you look at that and you compare that to something like alcohol, another, cheap, easily accessible, addictive substance, that the 90% of people in America drink alcohol at some point in their life, about 14% get addicted. And that's so similar to what we're seeing here. With kids, usually we protect children against addictive substances. So 12% of children endorsing a clinically significant and impairing level of addiction to these products is really very, very concerning. And we've been looking at some work recently on kind of older cohorts in the United States, and we found in particular women who are 50 to 64 had just their prevalence rate for ultra-processed food addiction is 22%. What is going on with this cohort? Well, in the US, it's really kind of the 1970s, 80s, we think, when the food environment really started to go off the rails. Big tobacco started to get involved. We focused on low fat, and we became all these ultra processed diet foods that were just total junk foods with high levels of refined carbohydrates and all these flavor enhancers flooded the market. And these women were teenagers and early adulthood, high risk period, both for addiction vulnerability on a neural level, but also diet culture. And so these women were probably eating, snack wells, low fat cookies and lean cuisine, chicken fettuccine, starchy milk, and thinking, oh, I'm trying to eat better for my health. I'm trying to lose weight. And instead, they were kind of getting hooked in this vulnerable period on these really unhealthy foods. And so I think there's really critical developmental periods of early childhood, of adolescence. And right now, all the children in the US are growing up in that sort of high risk period that those women grew up with at that time is now the norm. So it will be very concerning to see how the prevalence rates increase for future generations who spend more of their life under this food environment. And I see that, again, there's these bright spots. Tara Fazzino is a colleague of mine, and she's looked at the nature of the food environment in Italy. And there, it's so much healthier. In Italy, it has way less ultra-processed food. And their estimated prevalence rate of food addiction is about 3% of adults.
Interesting.
And so, again, I think and it's not like, oh, for 500 years, we've all been subsisting on ultra-processed foods. It's a relatively modern phenomenon. There's countries in the world that don't rely on ultra-processed foods, and they're a lot healthier. So it's not like this is an impossible problem to solve. We just need the political will to stand up against the big food companies.
Absolutely. But Phil Baker and colleagues have talked about the nutrition transition
Yes.
as it moves from high and middle.
Absolutely. We're just saying go from country to, it's like tobacco all over again. It's like this locust coming into these different countries and capitalizing them for profits. The Washington Post just covered a finding that if you look at baby food in poor countries relative to more well-resourced countries, there's more sugar in the baby food. Same exact product, but if it's in the US where parents are starting to push for less sugar in their foods, the same product sold in a poor country has way more sugar in it. And so it's just, the ethics of this is just so concerning given the global cost. And we're all picking up the health tab for the ultra processed food industry, because if there was no negative consequences, who cares, right? Like, have your Oreos, whatever, but it's impacting our physical and our mental health. And we're paying the bill while we're subsidizing these ultra processed food companies to optimize their profits and their vacation homes and, their fancy cars, while we're, paying medical care costs.
I remember as a child, someone brought a Mars bar from America and we tasted the difference, and it was sweeter. So,
oh my gosh, absolutely. Yeah. The same products in the US are, I think tolerance has occurred, that like as we've had a more and more sweetened diet, we've gotten less and less sensitive to it, and we need more and more sugar and a sweet taste, and then fat and salt flavor. You're always raising from a kind of neural reward level. As a society, we just need kind of more and more intense foods as you kind of become tolerant and acclimated to a certain level of intensity. And I always think it's interesting when you look at portion sizes. It's like portion sizes have been growing for ultra processed foods in particular, but minimally processed foods haven't been kind of growing as the bags of lettuce are not this ginormous, right? Whereas like sodas used to be this big and now they're humongous. And I think it's because you eat salad and you feel nourished by it, and you don't want to finish the whole bag of lettuce, but you do want to finish the whole bag of potato chips.
Absolutely. And can I just quickly talk about the Panarowski's paper that you
Panarowskis, yeah, absolutely.
The Association of Food Insecurity and Food Addictions symptoms, because you were looking at, there were two studies, the MAMAs, 208 pregnant women, and the FFS 181 caregivers of 8 to 10-year-olds. Can you talk a little bit about this paper? Because I think it's quite important.
Yes, and we have another one that's come out on the same topic, an even larger nationally representative
Right.
sample just came out recently. But that we're seeing that people, in that study, we saw even bigger prevalences, but that people with food insecurity were 50% more likely to meet for this ultra processed food addiction. The study we did in the nationally representative sample was an even larger magnitude of risk. Cindy Lewang is the first author on that one, and
Thanks.
Lindsay Parnarowskis is also a co-author on that article. She's really driven my lab to focus on the food intersection, social justice intersection here. But yeah, so we're seeing that like the individuals who don't have enough money to eat, they have to rely more on these ultra processed foods. It's a high stress life experience to not have enough to eat and not enough to feed your children. And so we're really kind of seeing that not having enough money or ability to access nourishing food is a real risk factor. And again, this is a social justice issue. This isn't, we all have to eat. You don't get to opt out. And so we need to make changes to really protect people who are and promote the best life possible through what you're ingesting, what you're putting in your body, optimizing that. Again, it shouldn't be a luxury good to be able to afford real nourishing food.
Thank you for that. To come from a New Zealand perspective, in 2015, 2016, almost 1 in 5 children, 19% lived in households with severe to moderate food insecurity, but with Maori children, over 1 in 4, 28.6% lived in food insecure households. So, and then if we looked at children in food insecure households, over 1 in 3 children were Maori. So, and that's, whereas Maori children only make up 25.7% of the child population. So we're New Zealand is absolutely vulnerable to this situation. Now, and can
Absolutely.
we please, to finish off, talk about your paper, the social, clinical, and policy implications of ultra-processed food addiction?
Absolutely. So, in that, a lot of that is focusing on kind of the things we talked about today. So we're seeing that it's really this kind of social milieu in our current food environment that's making people vulnerable to this. You mentioned earlier about food being communal, and I'm thinking about how much the ultra processed food industry has worked to break down the social ties around how we eat, that we're eating ultra processed foods while we're in our car and just like shoveling in our mouths or sitting at our desk by ourselves or on our couch by ourselves. That when I think of the way we've often socially communed around food, it's really changed. And that has so many consequences for, I think, our well-being. But we see that clinically, again, like this has people who meet the ultra processed food addiction, whether they're a child or an adult, are just having poorer quality of life across the board, mental, physically, socially, to a moderate to large effect size. This isn't a small effect. And so they're really suffering. And there's evidence that people with severe ultra processed food addiction are not responding as effectively to treatments, that they're more likely to drop out or not even qualify for the treatment that's accessible. And so this is really a group that is not currently being captured by diagnostic criteria. We'll be putting together an application for ultra processed food addiction to be considered in the DSM in the next 6 months for sure. And that, because right now they're just not being captured by existing criteria, and they're suffering. They're really suffering. So we need to help them and care for them and prevent these conditions. And we know that one of the most important ways we can do that is through policy. We know we need multifactorial policies, and there are countries that are starting to do this, like restricting advertising, increasing taxes on ultra processed foods, and subsidizing nourishing foods, education programs, warning labels on the front of packs for these unhealthy foods. All of these have actually really been taken from the addiction world and have been useful there, and are now being applied in the countries that have the will to invest in their citizens' health while benefiting from reduced healthcare costs, are seeing effects. And I'm just thinking of how you were talking about cavities. I just saw a talk that There's Philadelphia in the United States did pass a soda tax. And this is just one ultra processed food, but they saw in the health records of children on government support are children who are poorer, who are less well resourced. When the soda tax went into effect, the amount of cavities that poor children were experiencing in that city where soda was taxed relative to the city that's like right next door that soda was still really cheap, they saw less cavities. And so again, like cavities hurt and it inflames not just your mouth, but your whole body. And it's just, it could make it hard to concentrate. So these policies really can work. We just have to institute them.
Absolutely. And in New Zealand, fluoridation of drinking water is a proxy for this. But the problem is in the low income communities in particular, you'll get a far higher cavity ratio. So if fluoridation is claimed to reduce 1 or 2 cavities per month for these children that then have another 5 cavities, their parameters are still going. So that's, this is just delaying. And so what you're really drawing attention to is we need to classify ultra processed foods as addictive. And if we misclassify them, this is the policy failure.
I agree. It's like for decades, we knew that tobacco was deadly, but we didn't know it was addictive. And it was very helpful when we started to classify tobacco as bad for your health. But before we did policy initiatives to change the smoking environment, before we helped people realize that these were addictive substances and kids should not be targeted for them, we didn't see that much reduction in smoking and in the healthcare costs were associated with it. I think, if these ultra processed foods, which I would argue meet the same benchmarks we use to classify tobacco as addictive substances, they are consumed compulsively, they're highly reinforcing, they impact the reward centers of the brain, they shift mood, they induce high cravings. If we really thought of these ultra processed foods, like they have much more in common with a tobacco cigarette than they do an apple or a piece of salmon. If we really reclassified them in a way that really reflects more what our scientific understanding of their reward and harm profile is, I think we would really see a lot of gains in our physical and mental health. And right now, a lot of food industries can really slap health claims on their ultra processed foods, which confuse people further. All natural, put it has no juice in it, but it's got like cherries on it, high in protein, but it's got so much crap in it. Like it doesn't matter. It's not salmon. It's not a steak. It's a candy bar with extra protein added to it. That's just a different beast. No wonder people are confused. So we really need to just have a common sense approach to food created by Mother Nature and food created by a multi-billion-dollar international conglomerate that wants to profit off you. Like those are two very different things. And again, it's not that you should feel ashamed if sometimes you have chocolate. Like, this is not a goal of shaming the individual at all. I totally have chocolate. I will totally have a slice of pizza. And I know that it comes with a potential risk. And I don't want that to be what I would have to rely on to get sufficient calories to survive. So it just really needs a common sense perspective that promotes health in our society.
Absolutely. And I think once you are not eating an ultra processed food diet, if you then go out and have a pizza or a lasagna or an ice cream, your dopamine receptors you don't get the same craveability response. You don't get the same feeling, and so you still can go and have this and you enjoy it, but it's a really different technical appreciation.
Absolutely. I think of it as like, harm reduction approaches. If your body thinks you're starving and you're super stressed and you're using this to try and cope with depression or trauma, if you are already nourished and your body is satiated and you're with friends and you're celebrating a birthday, for many, many, many people, that is not going to come with a ton of risk. That is not our current food environment. Our current food environment is eat essentially cake and cookies and mainline sugar and ultra processed refined carbohydrate foods 24/7. And your body's never feeling nourished and it's never feeling satisfied. And your blood glucose is doing this all day and you're not sleeping great. And all of this is very hard.
I would like to finish by saying thank you so much, Ashley
My
Gearhardt, for
pleasure.
this time and all the work you're doing. You know, if anyone looks for Ashley on Google Scholar, they are going to find 2023 alone a formidable task to navigate. Best of luck with the DSM-5, and I look forward to keeping in touch. Thank you so much.
I do too. Thank you so much, Jody. I appreciate you interviewing me.
Best luck.